Frankie Sanders is a ninth grader who loves to play chess on his iPad and is trying to pass the test for his driver's permit. Frankie also has autism. As you may know, that's a neurodevelopmental disorder that affects language, behavior, and social skills. Boys make up the vast majority of cases. What you may not know is that 12 years ago, the Centers for Disease Control and Prevention began to estimate the total number of cases in the United States. They based it on a count of 8-year-old children with autism in select communities. If you look back in the years 2000 and 2002, it was about 1 child in 150 with autism. 2 years later, 1 in 125. Then, 1 in 110. And now the latest report, as of 2008, the last time an estimate was performed, 1 in 88 children has autism. That's a 78% increase just over the last decade. And the question on a lot of people's minds is why?
How much of that increase is a result of better tracking, and how much of it is a result of an actual increase? We still don't know.
Researchers have discovered many genes linked to autism, but in most cases, genes are only one part of the equation. And genes alone wouldn't change that fast in just 10 years. There is something else that triggers the problem.
We're talking about infections, we're talking about social conditions, and we're talking about exposures to toxicants, things in the environment.
Researchers are still looking for answers, but what they do know is that diagnosing children early is critical, as was the case with Frankie Sanders.
Frankie was diagnosed when he was 15 months old. He immediately began to get speech therapy and occupational therapy and physical therapy. He was placed in a group with kids who were typically developing.
All that hard work is paying off. Frankie is now 15. He attends a regular high school and plays on the football team.
We can diagnose autism at 2 years of age almost always, by 90% of the children, by 3 certainly. And we actually can diagnose it at 18 months in many children.
But according to this new report, most cases are diagnosed late, after age 2 or 3. That's when therapy has been shown to help the most, especially with speech and communication.
Parents need to be aware of their children and how their children are interacting.
And then they need to seek help.
If you as a parent are concerned about your child, talk to your doctor, talk to your school system to see if they should be assessed, get them assessed.
This is small.
The number of cases here in the U.S. are at the highest rate ever recorded. According to a new report, 1 in every 88 children either has autism or some type of related disorder. Dr. Robert Melillo is the specialist of functional neurology and co-founder of the Brain Balance Centers. And also with us is Fox News medical A-teamer, Dr. Manny Alvarez. Doctors, I'm so glad that you're here because this is a stunning report. The rate has it's jumped from 1 in every 110 children to now 1 in every 88 children. Dr. Melillo, what do you think is going on here?
Well, as you said, that's a 25% increase just in the last 2 years. That's actually doubled over the past 10 years. And part of the increase seems to be that we're better diagnosing it and we're more familiar with it, but that can't explain it all. So therefore, if we're seeing these types of almost epidemic increases, we have to look at environmental factors. That's the only way we can explain it. You can't explain it just through genetics in that way.
Dr. Manny, we should let our viewers know you have a child with autism.
Absolutely.
What do you think is at the root of this jump?
Well, look, I think the number reflects probably more diagnosing and identification from parents. I think that the number really doesn't mean anything. I think the number is showing that you do have a gross epidemic, and really nobody's paying attention. You know, our children are not being taken care of especially by the federal government at any level, because I'm going to tell you something. I deliver babies for a living. So if you say to me, Dr. Manny, what do you think the cause of autism is? I'll tell you, probably right now it's multifactorial. A little bit of genetics, a little bit of inflammation, a little bit of toxicity. I mean, we're poisoning our pregnant women out there today in America. Poisoning. I deliver babies. I know. We're poisoning pregnant women. So the cause is going to be multifactorial. The big ticket item is that right now there are no resources in America for autistic children, period, because the schools are not really educated, ready. Teachers don't know what to do. And this is going to be the biggest biggest epidemic in child development in America for the next 20 years. Put it in the bank.
And with this huge rise of 25%, as Dr. Melillo just said, will that change? Will it now get the attention that you're calling for?
No. It's not going to get the attention. You know why? Because right now, look, people are focusing on so many things in education today, and teachers will tell you, listen, our school budgets have been cut down. States really right now, half of them are all in bankruptcy protection,
so
as I like to call it.
What do you want to see that schools or doctors do?
Well, what I want to see is if you're going to provide services for, let's say, children, give parents tax incentives so that they can go ahead and hire some private tutors. Focus more attention in really developing skills in teachers. Provide services on the state so that we can get better recognition of symptoms and how well things are doing. Because I'm going to tell you, for a lot of children, autism is reversible.
I think what you're alluding to, it costs $72,000 a year to raise a child with severe autism. Dr. Manny said that pregnant women are being poisoned. I assume that you're talking about the toxicity levels of sort of everyday household things and the environment. Do you agree, Dr. Melillo?
Well, I think that we're also poisoning ourselves. Our lifestyle in general is hurting us. Statistics just came out last week showing that if a woman has obesity, high blood pressure, or diabetes, any one of those factors raises her risk of having a child with autism by 60%. Which means that those are reversible factors, and there's a lot of things out there like taking prenatal vitamins that people can do to lower their risk that are significant.
Is the silver lining here that now with these new numbers that are so attention-grabbing that there will be more research?
I hope so. There'll be more children diagnosed with autism this year than childhood diabetes, cancer, and AIDS put together. But yet, autism gets less funding for research than any one of those individually. So what needs to be done really is more research. We need to understand more what's happening, and I think with more research, we're going to find, as Dr. Manny said, that we can actually correct and reverse these problems.
There are so many people, Dr. Manny. Your family is obviously directly impacted by it. Every American family knows somebody with autism. We have to get to the bottom of it.
Listen, but as the statistic worsens, more critics will come on the table. Right now, there are critics out there that will say, well, autism is not real. These children just have bad behaviors. These are neurotic parents. You know what? That's what's going to happen. And that's why we don't make a difference. It's not in the radar. It doesn't affect anybody. It's not tangible. You can't touch it. Only the families that live through it really know. And trust you me, this is going to get worse before it even gets better.
Dr. Manny, Dr. Melillo, thanks so much for coming and talking about this very heated topic. We appreciate it. More America Live.